Diabetes is a chronic disorder that affects 8% of Americans. It is one of the leading causes of death in the United States, behind cardiovascular disease, cancer, and chronic obstructive pulmonary disorders. So it's very vital that people take their diabetes seriously. The only place in the body where we actually can see blood vessels is the back of your eye. And therefore, internists and general practitioners like ophthalmologists to examine their patients at least once a year. At that time, we evaluate the vasculature, and our premise is that if the vessels look good at the back of the eye, then they're probably good in your kidneys, your liver, your lungs, your heart, and your brain. But if they look poor in the back of your eye, then your therapy for diabetes is not being appropriate and needs to be more carefully cared for. Our role as ophthalmologists are to evaluate patients, many of which who at the time when we examine them have no idea that they have diabetes or that they have any diabetic changes, because many times the actual ophthalmic signs and symptoms are when the disease is progressed. Our goal is to make sure that blindness does not occur secondary to diabetes, and therefore yearly examinations are warranted, at which point we can intervene to make sure that it does not progress to blindness. In today's day and age, those therapies are laser and injections and are quite successful. But once you leave our office, we no longer have control of you. Therefore, it's important that everyone takes their control of diabetes importantly and sees their doctor for regular examinations and follow their medications. Thank you and have a nice afternoon.